People tend to confuse promiscuous sexual behavior with sex addiction. With promiscuous sexual behavior, a person has control over their sexual impulses. They can decide whether or not to have sex. A person with sex addiction has lost that ability to control their impulses, their sexual impulses. When a person has promiscuous sexual behavior, what literature tells us is that there's usually a motivating factor. There's a motivation, a drive for them to engage in promiscuous sexual behavior. And one of the driving forces is boredom. You're bored by your life, you're unable to find meaning from your life, you're unable to experience pleasure from other things, and so you pursue sex with multiple people to be able to get that pleasure from sexual activities. And these people are able to hold down jobs, they might be able to hold down relationships. So it's not causing impairment in function in their lives. But when they get caught, then they tend to use sex addiction as a way of getting away from the responsibility of their actions. With sex addiction, a person has lost the ability to control their impulses. So this person would have difficulty focusing at work. They would have difficulties keeping relationships because the impulses are too strong, the urges are too strong for them to bear. They consume their mind. They can't think about anything else. They're obsessed with the thoughts. And so to reduce that obsession that tends to result in anxiety, they tend to engage in the compulsive behavior of sex. And so it's very important when you're assessing a patient or even for yourself to understand the differences. Promiscuous behavior is usually as a result of maybe mental health challenges. And here you might have a boredom coming in form of the person you are right now is not the person that you want to be. So you're not your ideal self. You had plans about where you want to be in life and you're not there. And so as a way of escaping that emptiness, that sense of loss, that sense of emptiness again, you try to go into sexual behavior to pursue the pleasure in it so that you don't feel this. So it's a maladaptive coping mechanism that a person uses to deal with their problems, much like drug use, like alcohol, like cocaine, like cannabis and other substances. And so their treatment approach is going to be different. That's why it's very important to make a distinction in the assessment of the two conditions.